welcome to this explainer on identifying and managing an addiction crisis. Today, we're diving straight into a crucial medical survival guide based on the real-world protocols from iRely Recovery out in the Los Angeles area. Look, if you or a loved one are ever facing the truly terrifying prospect of severe withdrawal, knowing exactly what to do and exactly where to turn is absolutely vital. So we're going to unpack the essential steps you need to take to keep yourself or your loved ones safe.
Okay, let's take a quick look at our roadmap for today. We'll be covering spotting a detox emergency, standard versus emergency care, who's most at risk, the clinical stabilization protocol, and finally, taking immediate action.
Let's jump right into Section 1, spotting a detox emergency.
So we're starting with the absolute basics of triage here. What actually is emergency detox? Well, it's the urgent, medically supervised process of stabilizing someone whose withdrawal symptoms or their substance use have reached a critical, life-threatening level. The absolutely crucial point here is that emergency detox isn't your standard planned-out rehab trip. No, it's a rapid clinical intervention that requires advanced monitoring and a real-time response to literally save a life.
To spot an emergency, you need a rock-solid mental checklist to separate severe physical distress from critical behavioral warning signs. A physical crisis looks like active seizures, delirium tremens, DTs, a rapid heartbeat, and skyrocketing blood pressure. But the behavioral red flags are just as critical: suicidal thoughts, psychosis, a recent overdose, or a highly unsafe home environment. Both of these categories demand immediate action.
Now, here's a number to remember: 24. If someone has a total inability to keep food or fluids down for a full 24 hours, that is a massive red flag. You cannot just wait that out. Severe dehydration from vomiting or diarrhea escalates incredibly fast during withdrawal, and it demands immediate medical attention.
Moving on to Section 2, standard versus emergency care.
So while standard detox is all about planned intakes and nicely scheduled assessments, an emergency crisis throws that entire timeline right out the window. Emergency detox means immediate, real-time clinical intervention, often before a formal long-term plan is even fully developed. We're talking same-day or next-day intake, continuous cardiac monitoring, and high-level medication protocols. You aren't just sitting around in a waiting room. You're getting the 24/7 continuous oversight required to stop dangerous complications in their tracks.
Which brings us to Section 3, who is most at risk? We have to know who is most vulnerable during withdrawal so we can anticipate a life-threatening event before it even happens. We're looking at long-term heavy alcohol users, folks dependent on benzodiazepines, polydrug users, fentanyl users, pregnant women, and anyone with a history of past withdrawal complications. Why is it so critical to know this? Because without medical supervision, alcohol and benzo withdrawal can quite literally be fatal due to the severe seizure risks. And fentanyl users or pregnant women face incredibly high stakes that require highly specialized, immediate oversight.
Let's get into Section 4, the clinical stabilization protocol.
Okay, so what actually happens when you walk through the doors of a specialized facility like iRely Recovery? It's a highly structured safety net. Step 1 is a rapid assessment using established clinical scoring scales, like the CIWA scale for alcohol or the COWS scale for opiates. Step 2 is immediate stabilization with IVs and meds. Step 3 is that continuous monitoring we talked about. And Step 4 is building the continued care plan. This phone-to-bed protocol ensures that the second a patient arrives, hard clinical data is guiding immediate, precise, life-saving care. There is absolutely zero guesswork here.
And based on those assessments, the medical team uses highly targeted medications. They're not just handing out generic pills. Severe dehydration, that's met with IV fluids. Alcohol or benzo withdrawal is countered with specific, medically administered benzodiazepines. Anticonvulsants are brought in strictly to provide immediate relief and physically protect the brain from seizures. Meanwhile, buprenorphine is used to safely manage opioid withdrawal. It's an exact medical science, fully designed for patient safety.
Let's talk about the number 20. At iRely Recovery, if a patient comes in with a CWAS score above 20, or they're having active hallucinations, or maybe a recent seizure, they'd immediately skip to the front of the queue. That score triggers an alert and the case goes straight to the medical director for a personal review. In these moments, speed is quite literally everything. Plus, Emergency facilities have to actually be accessible when the crisis hits. That means a 24/7 urgent intake line that is staffed directly by a clinical team member, not some messaging service that'll call you back tomorrow. Because emergencies definitely don't stick to business hours, clients need to be assessed and actually receive those first-round stabilization medications within hours of their initial call, whether it's day, night, a weekend, or a holiday.
And that leads us to our final and most critical part, Section 5, taking immediate action.
You got to assess the immediate threat level so you know exactly who to call right now. If there's a loss of consciousness, if they've stopped breathing, if they're having an active seizure or experiencing chest pain, that is an acute collapse. Call 911 immediately. But to prevent escalating withdrawal symptoms from turning into that total collapse, you need to call an emergency facility like iRely Recovery. They're your lifeline for urgent assessment, expedited admission, and severe withdrawal management, right before things reach a breaking point. While you're making those calls and arranging help, follow this strict survival checklist. First, do not leave the person alone during severe withdrawal. Second, do not give them more of the substance unless a medical professional explicitly tells you to. Third, do keep them hydrated, but only if it's actually safe for them to swallow. And finally, do document their symptoms for the clinical team. This keeps your loved ones safe in the moment and hands the medical pros exactly what they need the second they arrive.
I want to leave you with this guiding principle because it really hits the nail on the head. When withdrawal symptoms become dangerous, there is no safe way to wait it out. Emergency detox provides the medical intervention needed to stabilize the body, protect the brain, and create a pathway to recovery. You simply cannot tough out a medical emergency. Your life or the life of your loved one is absolutely worth immediate action.
So now that you know the clinical red flags, the huge difference between standard and emergency care, and the exact step-by-step actions you need to take, you have to ask yourself, will you make the call that saves a life today? What are you going to do to bridge that gap between a terrifying crisis and absolute safety? Thank you for tuning into this explainer. Stay informed out there, and most importantly, please stay safe.